Hi, oxygen delivery devices part 2. Last week we covered the nasal cannula, the high flow nasal cannula, the simple face mask, and the oxy mask. This week we'll cover a few more oxygen delivery devices, and I would like to start with the Venturi mask. I don't have one here, but I'm going to use the simple face mask to describe it. So the Venturi mask is an air entrainment device. So it's something like this, but the difference is that this piece right here is either a dial or a valve. If it is a dial, it has it is numbered the oxygen concentration, the liters, how much liters of oxygen is going in or is being entrained is numbered. So if, for instance, you want to put 2, there is a 2, so you dial it to that 2. But the ones that have valves is color coded. So instead of this whole thing here, this whole thing is removed and the valve is inserted. So they are color coded and they all have different concentration of oxygen. The thing about the Venturi mask is that it delivers precise concentration of oxygen. So with the valves, there is the blue, there is the white, there is the yellow, there is the red, and there is the green. The lowest of them is the blue, and it delivers 2 to 4 liters of oxygen, which is 24% FiO2. Then the highest is the green one, which delivers 12 to 15 liters of oxygen with FiO2 of 60%. So Venturi Max, the FiO2 is from 24% to 60%. So that's it about this max. If you want precise concentration of oxygen, depending on the patient's condition, this is what is being used. This, of course, is attached to oxygen source. Then I have the non-rebreather mask. The non-rebreather mask looks like this. It's a face mask, but it has connected to it a reservoir bag. And this reservoir bag has oxygen source directly entering inside. So this bag should be partially filled with oxygen whenever the patient is using it. So what it does is that it prevents the rebreathing of CO2. There is another one that is a partial rebreather bag, but I don't have it too. So it's just the same idea with this one. So this one is the non-rebreather valve, non-rebreather mask. That one is the partial non-rebreather mask. So that one, so this one, that's the idea for the two of them. And this mask right here, it's your go-to during emergency. If your patient is dropping fast, before you do anything high like intubation or anything, this is the first thing you go to because it delivers the highest concentration of oxygen. It goes up to 100% when you put the liters to, I think, 6 to 15 liters on the oxygen source. So that's it for this one. Then there is the face tent or face shield. This one is mostly used in children because they don't cooperate with the face mask or the nasal cannula. So the face tent is mostly used in children. It's quite big and it covers the whole face. Now, that reminds me, let me mention something about using face masks as against nasal cannula. Face mask is better suited for mouth breathers, people who breathe with their mouth. That's the best oxygen device that you can use for them when you are comparing it with nasal cannula. Then let's go on. Which other ones? So I've talked about the Venturi mask. I've talked about face masks. Face masks, by the way, is 10 to 15 liters of oxygen. Then the non-rebreather mask, 6 to 15 liters of oxygen. And I think that's pretty much it. Then I'll just mention some other oxygen delivery devices. And the first one I'm going to mention is the trach collar. The trach collar is like a mask, just a small mask that is used to cover the tracheostomy tube, and then it's now attached to oxygen source. Then there's the T-piece. The T-piece also goes on the tracheostomy tube, and then it is attached to the ventilator for the patient, to help the patient to breathe. Then there is the bag mask valve. That's the one we know as ambu bag. That one, you know, is mostly used for emergency, just like an in-between before you intubate the patient or do anything more than what you were doing. So that's what you use to keep the patient breathing before you get a stable device that you are going to use. Then there's the BiPAP and the CPAP. These ones are small portable machines or settings on a bigger machine that can be used to support oxygenation for patients that have a certain condition such as obstructive sleep apnea and other chronic respiratory conditions. So that's the BiPAP and the CPAP. Then the ventilator, of course, is one of them. Then the endotracheal tube is also a piece you use. And then there is ECMO, that's extracorporeal membrane oxygenation. This is when cannulas are inserted into a patient. The patient's blood is taken out of the patient's body, oxygenated, and sent back to the patient's, something like exchange blood transfusion. So that's pretty much it for oxygen delivery devices. Thank you for listening. Make sure to like, share, subscribe, and follow for more.